Thank you so much. And thank you again for joining us this morning. So just to get us started, I am here with a few other CJC staff, and we will introduce ourselves before we get into the content, and I'm glad to get us started. My name is William Ash Houchin. I'm a senior research analyst at the Oregon Criminal Justice Commission, and I work on our behavioral health initiative. And I'm so pleased to turn the mic over to my colleague, Monica.
Hi, morning, everyone. I'm Monica. I'm a research analyst here at CJC. I also work on BHD and a couple other projects as well. And I'll pass it to Avery.
Thanks, Monica. I'm Avery Sorensen. I'm a grant liaison here at the CJC, and it is good to see all of you here.
Thank you so much, Avery, and thank you so much to everyone who is in attendance today. We will go ahead and get started with our content. And so the first thing that I just wanted to remind us all of was the sort of background and context associated with this grant program. So as you know, the purpose of Oregon's behavioral health deflection programs is to address the need for more deflection programs and assist individuals whose behavioral health conditions, including substance use disorder or other service needs, lead to a heightened likelihood of interactions with law enforcement, incarceration, conviction, and other engagement with the criminal justice system. And so a deflection program then is defined in House Bill 3069 as a collaborative program between law enforcement agencies and behavioral health entities or community-based social services organizations that assist individuals who may have substance use disorder, another behavioral health disorder, or co-occurring disorders, and who often have other service needs to create community-based pathways to treatment, recovery support services, housing, case management, and still other services. And the CJC throughout 2026 has hosted a number of listening sessions relating specifically to deflection data for tribal government programs. And I do just want to resurface some of the primary themes that we heard as part of those listening sessions earlier this year. And so 3 of those themes were strong preferences for data reporting for tribal government programs to be high level, as well as aggregate, and then the reporting cadence to be not more frequently than quarterly. And so with what staff learned, we built a reporting mechanism within the same system that is used for grant applications, and we call that SM Apply. And the quarterly data reporting mechanism has been built in alongside financial reporting. And there are 12 items that we will look at in just a moment together that we hope to be reported quarterly in the aggregate. And so rather than asking about specific details about an individual participant, for example, what we're asking for in this reporting is counts and totals in specified areas for the entirety of the program for that time period. And so our goal today is to review that reporting structure, and then any opportunity, there is plenty of opportunity for any questions or discussion about its use. I do want to remind us broadly what these items relate to. We will look at each one of them in just a moment, but we can take these 12 items and split them into roughly 4 categories. And those categories themselves generally have at least one item within them. Most have more than one. So when we talk about these reporting items, we are really focusing in more on the front end of that program. There are a few items that help us better understand engagement once participants are enrolled into programs, but by and large, the majority of these 12 items are really about referrals and the sort of front end of the programming when folks are referred and potentially enter the program. And so specifically relating to those referrals, we're asking for the overall count of referrals, as well as the counts of those events that were qualified to enter a particular program, and then the number of individuals who then ultimately did enter that program for that particular order. We are also asking about the number of events that were successfully completed in that particular quarter. And then more about those referrals, including the pathways, those 6 nationally recognized pathways that the participants may enter with. Not all programs will operate all pathways, so whichever pathways are appropriate for your program design. And finally, in this referral section, we ask about the type of handoffs that were received by the participants who were engaging with the program. This next section is still very front end. It asks about the criminal charges or lack thereof for participants who are entering the program. Right? So when those folks are referred to the program, we're asking for how many of those events had a PCS associated with them, and how many of those events had a non-PCS offense included with them. And then those events that had no criminal charges associated with them. And again, your program design will determine, right, what types of criminal charges or other events are eligible for your program. The third category here relates to social determinants of health. There is one item here, which is about the living arrangements for a particular, for that set of participants. And that one can be tricky, and I'm looking forward for us to take a look at that one in just a moment as well. But it's really asking about the living arrangements for those folks who came into the program for that particular quarter. And then finally, the last category is relating to engagement. So that is sort of in the mid to later parts of the program. And we are asking for counts of 2 things. The count of events where the participant received any screening or assessment, as well as the count of events where the participant received any treatment or service. And so what we are not asking, right, is for clinical details about individual participants. We're asking at the program level, how many of these participants either received a screening or assessment or received any treatment or service. And so the next item in our agenda is to walk through those reporting items live in SM Apply as you will see them. But I did want to pause here to see if there were any questions about the material that we just discussed before we transition to that live walkthrough in SM Apply. I see no questions in the chat. Thank you, Kelly. I'm not seeing any questions or anyone coming off of mute. So if you will bear with me for just one moment, I am going to stop sharing so that I can reshare with the SM Apply live walkthrough. So please bear with me one moment as I reshare the screen. Okay. So what you should be seeing now is a browser window that is mostly white. If someone could maybe give me a thumbs up if you're seeing the right thing. Thanks so much, y'all. Thank you, Avery. Okay, so when you log into SM Apply, you may have fewer or more of these small white boxes that you see along the screen, each with a green button. But what we are looking for here is the one that is Oregon Behavioral Health Deflection Program, Tribal Governments. And you will see several things here. You will see a due date for the particular tasks that are associated with this. And then we can use this green button within the small white square itself to access the application and the quarterly reporting. And so you will notice that there are 4 tasks here. The only one of these that we're talking about today is the quarterly reporting Q5 Tribal BHD data reporting task. There was a webinar earlier this week relating to the other tasks about the application, and you should have received an email with the link to the recorded webinar relating to those. But if not, please let us know and we would be glad to provide that to you. So what I will do next is click on the quarterly reporting item. And it will bring us to another page, the topmost portion of which contains just a few instructions. This specifies that this particular set of data reporting is for Q5. I will zoom in just a bit so we can see a bit better. And then it also provides particular dates. So for this quarter, and these will change at each subsequent quarter to help everyone stay on track. But for this particular quarter, the dates range from April 1st of 2026 to June 30th of 2026. And we recognize that some programs got an early start and may have been serving participants in March or earlier in 2026. And so since this is our first time doing data reporting, we are going to ask that any participant served through June 30th of 2026 be entered in this first set of reporting items. And so I am pleased to go through those items. If anyone has a question, please jump in at any time and interrupt me. There is no need to wait and hold any questions until the end. So as I mentioned, most of these items are on the front end and relate more to the events, the referrals, and how folks are coming into programs. And the very first item here asks for the total number of essentially referrals that your program received for this particular quarter. And so I do want to make a note here. You will see some bold typeface beneath the item description itself that says a value must be input if NA enters 0. And so here I have input if you add a number here, we can remove or edit this at any time. If your program is not operational or an item does not exactly apply, then if it is not applicable, you can simply put a 0 in. And so for this quarter's reporting, if your program is not yet operational, you may put zeros for each and every item. And in some cases, even if your program is operational, you may still end up inputting 0 for one or more items, depending on how those participants have moved through your program. And so the very first item is the broadest, and this item asks for the total number of referrals. And so here, I just had a value of 10 input, and we can perhaps proceed with this example of a program that had 10 referrals as we move through the rest of the reporting structure, just as an example. Your counts or values for your program may differ significantly than what you see on the screen here. And so for this quarter, for this example, we started with, let's say, 10 referrals for the entirety of the quarter. The next item is similar, but it asks, of those 10 referrals, how many of them were eligible for your program? And so programs set different eligibility parameters and exclusionary criteria. So we're only asking for the count of those total number of referrals that qualified. It can be the same number, but it should not be larger. More people cannot qualify than were referred, or if you're potentially maybe running like a self-referral that referred themselves. So the largest number here should be the overall count of referrals, although you may have matching numbers in many places. So again, the first item is the total count of referrals, whereas this second item takes us one stage in and asks how many of those total referrals were eligible for your program. Okay. Just looking to see if there's any questions. If I'm moving us down just a bit. Okay, so to continue with our example here, if we had started with those 10 people and we discovered that 9 of them were eligible for our program, we would input that value. And then the third item here sort of takes us one step beyond that. So we started with the total number of referrals and moved to the total number of people who are events that were qualified. And then we ask the total number of events where the eligible participant agreed to enter the program. So we're just sort of building off of that in a little bit of a way. But again, the numbers here may be the same. You may have had 10 referrals, 10 people were eligible, and 10 people entered the program. or the counts may be different. So continuing with our example, we'll move down to the next item. We're still only talking about referrals into your program. We're asking about the pathways for each of these of the total count of referrals. Now, as I mentioned, some programs may or may not operate all of these 6 nationally recognized pathways. But what I put here in the text boxes is the example of how these may array over the available pathways in your program. So in our example, we had 10 referrals, 9 folks were eligible, and 8 people went in. So what we're asking for here is to know the pathways for those referrals that are coming into your program. If you only operate one pathway, then everything will be on one line in this item and the remainder would be 0. Or it may look something like you see here on your screen now, where we had 10 referrals, and as I've indicated here, 2 came in under a particular pathway called active outreach, and then potentially 4 each for 2 other pathways, that first responder and officer referral, as well as law enforcement intervention. And I just want to say again, if your program is not operating all of these pathways, that is okay. It is not a requirement to operate each pathway. We're only asking for an accounting by pathway of the referrals into your program. Pausing for questions as I'm moving us down to the next item. As I mentioned, we ask about handoff types as well. There are more choices for this item, so I am going to zoom us out just a bit to get more of them on the screen. But similar to the last item, the ask here is across the program in this quarter for the total number of referrals that you have to please indicate the handoff types. And so as we see here, if your program only operates one type of handoff, for example, if it's always a warm handoff to a peer, for example, then all of your referrals may say that the count may be only there with 0s throughout. But what we've seen in generally in practice, at least on the county side, is that often there is more than one type of handoff across a program. And so I've reflected that here on the screen as our example. So for most of these in our example program, the value is 0. And we would say here that the program tries to do warm handoff to peers, but that may not be available 24/7. So when that warm handoff process is not available, some of the referrals are handed off another way. And so again, the idea here is just to capture how the handoff to your program is occurring across the program. Okay. I'm going to move us down to the next item. Everything we've talked about up to now has been related to those referrals into your program. And these next 2 items are also relating to the events that are coming into your program. And these ask about charges and co-charges. So I'm going to scroll us down so that we can see all 3 of these because they kind of work together, right? And so it is often the case that when the law enforcement intervention pathway is being utilized, that a participant may have potential criminal charges associated with that event. In some cases, that may be that they were in possession of a controlled substance. In other cases, that could be that they were in possession of a controlled substance while also engaging in some other type of criminal behavior. Often these can be sort of what are sometimes called quality of life crimes. These are often nonviolent, lower level offenses. I've listed a few here in the reporting structure, like low-level theft or low-level trespassing or something called offensive littering, for example. And so here we're not asking for that participant's individual details. We're simply asking how many of the events into your program had a possession charge only, how many had a possession charge and at least one other criminal charge, And then we are also asking in number 8, how many events entered with no criminal charge? We've heard and we know through the literature that some pathways do not require a criminal charge for the individual who may have those other service needs and be at risk for future criminal legal involvement, but they may not have any charges. And so we wanted to make sure and try and account for each of these 3, again, on the front end for the entirety of the program. And so generally, it should be the case that your total count of event referrals, they should largely be able to split across these 3 items in the most accurate category. And so just to run through them one more time with the example values that I put in our original example, we had 10 sort of events that were referred into our hypothetical program here. And we could say that maybe 6 of those came in with possession of a controlled substance only and no other associated criminal activity on perhaps an officer intervention pathway. And it can also be true that the program operates maybe an active outreach pathway and folks are invited into the program or referred with no criminal charges. And so we have accounted for that in number 8 by indicating that 4 of our 10 potential participants or participants at this point have entered with no criminal charge. So for these 3 items, if we were to add them together, they should be that number that we input at the very beginning for the total count of referrals for the quarter. So I'm going to move us to the next set of items. I'm going to pause again in case there's any questions before we proceed. Okay. Seeing no questions, y'all, you can jump in at any time if you have a question. The third of the 4 categories that I mentioned earlier relate to the social determinants of health. And this is a longer item, but the structure of it is asking for the same things as the ones that preceded. So I'm going to zoom out just so we can try and see this all in one go here. But these categories all relate to a participant's living arrangement. So this item relates to housing. And what this item is asking is for you to count across these Oregon Housing and Community Service categories or types of living arrangements. And then the headers that you see where it says something like unsheltered homeless or sheltered homeless or temporarily staying with others, these are the sort of categories that correspond to an HMIS system. And so that is why this item is structured this way. We wanted it to be as similar as possible to what one might see if one were to enter that participant into an HMIS system. And so, again, we're asking for those folks that enter your program that you have an opportunity to assess and screen and serve. What is their living or what are their living arrangements when they enter the program? And so there are several categories. I don't know that I will be able to fit them all on one page. The list here is exhaustive to our knowledge, but it covers things such as living outside or in a tent under unsheltered homeless. And here for our hypothetical program, I indicated 2. Perhaps there were 2 participants who were living outside or in a tent when they joined the program. As well, I indicated that there were 2 of our 10 participants who were living in a vehicle. And then you will notice that the rest of these, for example, the emergency shelter, the safe haven and transitional housing, in our hypothetical program today, we did not have anyone who had that living arrangement when they entered our program. So to scroll us down just a bit more, I'm trying to get as much of this on the screen at once as I can. Temporarily staying with others indicated that 2 of our participants were staying with family in a short-term arrangement. Indicated among the permanent housing situations that 2 of our participants own their own home. But you'll notice that the rental housing, the living with family and friends as a long-term or permanent arrangement, and then some of the other categories like college dorm and student housing simply have 0 to reflect that we had 0 participants in our hypothetical program in this quarter. And so the 0 is perfectly appropriate. And y'all, I'm sorry this item is so long. We did take the categories from the HMIS data handbook. So as we move down to the last of these, all of which you'll note have a 0 associated with them in our hypothetical program. But we do indicate institutional settings such as foster homes, substance use treatment facilities, and jails or other correctional facilities. And then there are a few things indicated in other, such as a hotel or motel stay that is not being subsidized, and then an opportunity or place for don't know. And so moving us down to our last 3 items that have a sort of example here. 2 of these are the sort of middle part of the programming, which is where folks are entering the program. And then we ask overall for this quarter, how many of those events that entered your program received a screening or an assessment? We're not asking which one, just any screening or assessment. And we note here that this includes any type of tool used, whether that is something like the ASAM or whether that is something that was created locally to meet the needs of a particular target population or jurisdiction. And so any screening or assessment, we just want to know how many of those folks who entered in that quarter received that. And so here, if you will recall from early in our walkthrough, I had indicated that we had 10 referrals, 9 were eligible, and 8 entered our program. So here, all 8 of our participants received an assessment. If that may or may not be true for your program, we're only asking for the count. And then number 11 takes us just one small step further. So 10 was about screening and assessment. And 11 asks how many of those folks who entered your program in this quarter received any treatment or any service at all. So again, we're not asking whether they received like SUDS treatment versus mental health treatment versus wraparound services, just any treatment or service. And again, that number may be the same. It may be that all, it may be all, or it may be fewer than all. And here, just to reflect that, I indicated 7. So we had 8 folks who got a screening or assessment. And then in this hypothetical example, we lost one of our participants to follow-up. And so that participant could not be located. And so they ended up not receiving a service from our hypothetical program. And that brings us to our very last item. Again, questions are always welcome. This very last item asks the total number of deflection events that were successfully completed this quarter. So recognizing that folks may sort of enter in one quarter and they may, be in the program for a duration and leave, we're asking for the number of successful exits from the program in a particular quarter as well. And so I do want to pause here and show one last thing, which is once you have gone through and entered either all zeros if you're not serving participants, or the values and associated with the counts for your program, you'll need to mark as complete this task. And so I'm glad to pause here in case there are any questions about what we've just looked at together in SM Apply. And if there are no questions, I have just a few more slides for us today and another opportunity for any discussion.
Hey, I have a quick question about the social determinants of health and housing. So are you asking for us to report the situation? Oh, you said, I was looking back at that. Okay, so when they first enroll, so not when we're reporting, kind of after the deflection intervention.
Yes, the ask is so essentially like when they've entered your program. And if you have that information for all of the referrals, that would be ideal. But what we've found, at least on the county side, is that is rarer. It's really once the participant enters the program and through the course of that either screening assessment or that that case management, those first interactions, that's generally when we've heard that folks are able to get that housing information. But if it's available for all of the referrals, that's great too.
Okay. Okay, cool. Yeah, that makes sense. It's kind of pre-intervention. What is their housing status?
Yes.
Got it. Thanks.
Of course. Y'all, are there any other questions before we move back to the slide deck? Okay, seeing no more questions, bear with me for just one more transition as I put our slides back together, back up here for us. All right, so you should be seeing my question slide again. Any questions about anything that we've covered up until this point are most welcome, and I'd be glad to answer them. Okay. So seeing none, there is one last thing that I did want to let everyone know about today. Questions about data reporting are always welcome. I have contact information on the next slide, and I would love to hear from you if you have any questions or problems as you're trying this out in SM Apply. Please reach out and I would be glad to help. But I do also want everyone to know about an exciting new opportunity, which is that implementation technical assistance for tribal government programs is starting in July. That is next week. So please be on the lookout for an email from Dr. Dan Hoover at Oregon Health and Science University with more details about this exciting opportunity. So I did want to take just a moment and talk about next steps. So the reporting window is open for tribal government programs, as is the application. And as we saw earlier, these are separate tasks in SM Apply. And so we are asking that all tribal government programs that have served at least one participant to enter data for any participant served up through June 30th of 2026. So anyone that comes in through essentially Tuesday of next week, we're asking for y'all to report in this quarter. And so if you are not seeing participants at this time, you may go into that task in SM Apply as we saw and just enter zeros down the board. However, if you are serving at least one participant or have served one participant in the past, we're asking you to report for any participant up through June 30th in this quarter. And then in each subsequent quarter, we'll only ask for those specific dates. We're just wanting to make sure we get the counts for anybody who's already been served in the program before April. Are there any questions about the next steps, the reporting structure, or anything else that we've talked about today? Okay. Seeing and hearing no questions. I do have contact information here for myself at the bottom. Please email me if you have any questions or concerns or problems that you encounter as you are working through the data reporting. I would be happy to help. And as well, I've included contact information for our behavioral health program manager, Casey Beck, who was not able to join us today. And so, of course, Kelly, thank you so much. So y'all, I'm glad to wait and see if there are any more questions, but I do just want to say thank you so much for attending today, and I look forward to being a resource for you as we proceed. So seeing none, I just want to say thanks so much for attending today. We will go ahead and be finished. And as I mentioned, we will send this recording out for anyone who was not able to attend today, or in case there are questions in the future. The recording will be available as well as me. I'm glad to help. So y'all, thank you so much for joining us on a Friday around lunchtime, and I hope everyone has a wonderful weekend.
Thank you.